Okay, so we are going to talk about STIs and HIV this week. The slide seems to say week 6, but it's actually week 7, so I'll have to fix that. But keep in your head this is week 7, in fact. So STI overview. So I'm going to talk a little bit about STIs and STI epidemiology and why it's important. So why be concerned with STIs? Our sort of gut would tell us that we have medicines available, and why are we talking about STIs in 2020? But STIs, as they have always been historically, have always impacted people between the ages of 15 and 44, so prime working age and prime reproductive age. And this is a lot of people, obviously. Many STIs are asymptomatic. People don't actually know they have them until they get a test. And there's differences between men and women. Women often tend to have more asymptomatic cases than men, or at least are more difficult to spot. STIs adversely impact reproductive health. We're talking about PID, ectopic pregnancy, infertility, and cancer of reproductive system. So yeah, huge issue, obviously. And again, they disproportionately impact women, minorities, and marginalized groups. So I think what you'll find when you see like historically how people have approached STIs, it's primarily been sort of a white, sort of straight male centric focus. If you look in the history, this has obviously changed a lot. But the reality is that STIs impact the most marginalized parts of our society all throughout the world, and disproportionately impact women. So while we're talking about history, we used to talk about STIs as being venereal disease, and that's actually what people called it when I was a kid, which caused from Venus, the goddess of love. And you can see there's this sort of male-centric view here. Venereal disease is something that men get from prostitutes, or at least that's the way it was presented. It's never used in modern contexts. It's considered judgmental and extremely antiquated. Definitely don't recommend, calling STIs venereal disease, because you'll sound like you're 80 years old. Be very strange. And also, STIs, there's, people don't intend to get STIs. It happens through circumstance. So I don't think we should blame the victim in any case. It moved on to be called sexually transmitted disease. This sort of started being sort of prevalent around the 70s, I believe. But this often refers to a chronic state of illness as a result of infection. Sort of the difference between disease and infection. Disease is the sort of symptomatic presentation. Infection is actual infection by the pathogen itself. So these days we refer to STIs as STIs, sexually transmitted infections, the preferred term, particularly when you consider that most infections are asymptomatic. So it becomes important to call it what it is. STID has also been proposed, but hasn't really taken a hold yet. So while we're speaking about terminology and stigma, there is a paper I posted onto Moodle about a research project on 2 university classes, and this is a sample size of 491. In one class, they use the term STD, and the other class, they use the term STI. And what they found was there was really no difference between the level of knowledge of each class, but the people who received messages that said calling it STDs had a sort of more negative impression of the infection or the disease, calling things gross, scary, and embarrassing. I think as public health professionals, we need to sort of avoid, looking at things as gross, scary, or embarrassing. There's nothing embarrassing about disease. There might be things that are gross, but we're used to it at this point. And of course, we should be scared of being infected, but we shouldn't be scared of those who are infected, for sure. So you can see why it's important to get the terminology right here. And this is not sort of, a talk of political correctness or anything like that. It's more like, people who become ill are victims in themselves, and there's no reason to stigmatize those particular people. So STI severity goes through steps. So asymptomatic to symptomatic, to inapparent or mild syndromes, onto serious complications, and onto severe sequelae, and most severe in women and newborns in general. Symptomology of STIs, there's obviously lots of STIs out there, and they range in their presentation widely. But generally speaking, when we talk about things that we refer to as STIs, we're talking about diseases that have urethral discharge, genital ulcers, inguinal swellings, scrotal swelling, vaginal discharge, lower abdominal pain, and neonatal eye infections. And sort of want to point out to this website from the UK demonstrating different STIs through fruit, and I found that extremely interesting. Thought we'd check that out. Special features of what we call sexually transmitted infections are it assumes direct transmission from person to person. Transmission generally depends on human behavior, so interventions thus focus on behavior modification. Transmission is via sexual activity, so rectal intercourse, vaginal intercourse, oral intercourse, and other sexually related contact. But some pathogens that are called STIs actually have multiple pathways of transmission. So you think of things like HIV, for example, which is also transmitted through blood transfusions. And these include sexual pathways as well. Some pathogens include sexual pathways as well, but are not normally considered as formal STIs. And so brucella and Q fever would be in this camp. It's known that bacteria can exist in any sort of bodily secretion, and that includes semen and vaginal secretions, and sexual transmission has been documented in brucella. So it's not traditionally considered an STI, but there is sexually transmitted pathways there. Moreover, there's many infections that are considered to be STIs that are transmissible through non-sexual behavior, as we mentioned. So trachoma, crabs, as we'll see, and HIV are examples of this. So when we look at the term sexually transmitted infection, it's not a given there's not a sort of hard definition of what that is. Pathogens are extremely complex. The term STI is meant as a guide for clinicians and public health professionals like yourselves. And really, in the end, it depends. So yeah, keep that in the back of your head. These classifications are not hard definitions. They are guides to guide the way we approach things from a public health perspective. Groups of infectious agents, obviously they're everything: bacteria, viruses, protozoa, ectoparasites, all over the place. So, sorry, my nose itches. Stop that. And these are not all the sexually transmitted infections. There's obviously more than this, but these are the common ones. Ulcerative versus non-ulcerative STIs, and there's a list here. Herpes, syphilis, chancroid, scabies, trauma, excoriations. These are all things that have visible and physical presentations. Others: gonorrhea, chlamydia, candida, trich, bacterial vaginosis, endometriosis do not. So ulcers versus non-ulcers. Now, this is important to note. It very much impacts the epidemiology of STIs. Trying to see if my mic is still there. Symptomatic and asymptomatic have disparities amongst men and women. Men tend to have more obvious symptomatic presentation. Women do not. In part, this is partially because of the mechanics and the morphology of both sexes. And so you can see how this would not only impact clinical approaches to the diseases, but also to the transmission. So if women do not know they're infected, they are likely to keep behaving in a way that allows the disease to transmit again. If a person doesn't know they're infected, what can they do about it? So definitely don't take away from this sort of antiquated idea of women being hard bringers of disease, and men being sort of lecherous yet sort of passive victims of STIs. That's kind of an old and nonsensical idea. Men and women both likely to be infected. They present in different ways, and this can impact transmission. And so, of course, should impact how we approach problems from a public health perspective. STI prevalence by gender, it varies by type of STI. But you can see overall here, women are more likely to present with STIs than men, for sure. That includes all of them: HIV, syphilis, gonorrhea, chlamydia, HSV2. More than one STI. Women are more likely to have more than one STI in the study. Chlamydia and gonorrhea rates, ages 15 to 19 by gender. Again, females more likely to be infected. Infectious syphilis positivity rate by gender sexual preference. Again, women much higher. Men, even men who have sex with men in this graph are lower. There's also racial, ethnic disparities. So this is our STDs overall, and African Americans in this country are more likely, higher risk for STIs than other ethnic groups, particularly more than white people. So socioeconomic disparities runs, like how many other passages do. Wealthy people are at less risk, or very poor people are at the highest risk. Follows all the patterns that we see in a lot of other infectious diseases. Women, marginalized groups, marginalized socioeconomic gradients. STIs by state. I think this is overall STIs in southern United States, poorest part of the country, in Alaska, particularly in indigenous areas throughout the country, high rates of STIs. So what I want you to take home here is the STIs are a social justice issue. Women, minorities, and socially disadvantaged are at higher risk for infectious disease overall, but these disparities are particularly pronounced in STIs. And I want you to think about, why could this be? Just sort of push it around your head. Why is this the case? All human beings are having sex, for sure. But why is it that the socially marginalized and the poor are at highest risk for STIs? What are the specific factors that could contribute to this phenomenon? So it's one thing to say poor people are at higher risk, but what are the specific factors that cause that phenomenon to occur? That's what I really want you to think about over the entirety of this course, for sure. So that's it for this presentation. We're going to move on to a bestiary of STIs, which I hope you're going to find interesting. So thanks very much. And if you have any questions, please reach out, because I am here to help you.